and professor of medicine. He's considered among the world's experts on COVID-19. He spent the last year dedicated clinical and academic efforts to combat the SARS-CoV virus. So would you welcome with me to Flashpoint Dr. Peter McCullough. Thank you, sir, for joining us tonight.
Well, thanks for having me on the show.
Yeah, all right, so Doc, knowing what we know now concerning children and those with comorbidity issues and its impact on those with COVID, should we again put the entire population under quarantine?
You know, listening to your opener, I really sense a lot of tension that's occurred certainly in the last several weeks across the country. And it's even affecting each and every one of us personally. These are my own views, and I don't have any employment or affiliation with Baylor or Texas A&M, but just the same day that Baylor Scott and White Health System, really a first-class organization. My wife and I are major donors to Baylor. I've been there for many years. I'm on staff at the facility. The day they announced mandatory vaccination for the employees, they actually hit me with a lawsuit. And the lawsuit was summarized in the Dallas Morning News, and it basically implied that I'm a vaccine skeptic and that I've violated some form of terms of a separation. And of course, I didn't do that. I'm here on this program and any program to really discuss the science and have a fair exchange of information. Many times I'm brought on with other experts, and doctors need free scientific discourse. That's how we ultimately get the truth. That's what you're about. And what we know with children and masking is that there have been 12 randomized trials. None of them show any benefit of public masking. There's been the Dan mask trial, specifically in COVID-19. They don't work. I'm a doctor. I wear a mask at work, and it's reasonable. I think dentists, doctors, those working at close range. But there's no support for masking of children because they're well, and we know that asymptomatic well children, they don't pass the virus to one another.
So let me ask you a real blunt question. The COVID and the measles, the common cold, the flu, it's interesting to me that we don't hear anything in 2020 about the flu virus, and we're still not hearing about flu cases. What's the deal with that? Are we getting all this stuff all mixed in together and everything's getting thrown one way or another?
Well, we learned from the CDC this week, in the last few days, that the COVID-19 testing, the PCR testing, had become so sensitive that, in fact, it was turning positive with the flu. So unless a doctor specifically ordered a flu test and a COVID test, it turns out if someone had the flu, they would be incorrectly labeled as having COVID. And so that was, in a sense, a misdiagnosis, invariably, of some flu cases as COVID, but in fact, they probably didn't have COVID. And so this is now, this application for supporting this test under the emergency authorization has been withdrawn.
There you go. Emergency authorization. That's right where I was going next. It's already been withdrawn. You know, let me bring Lance in here. Lance, did you hear what the doctor said? I mean, there's no, I was tested. I was around a lot of people that had COVID, and I kept having to go get a test, and they never test for flu. They test for COVID. I mean, I've had all sorts of tests done over the last year. And now, you know, it really seems more suspect than ever.
Yeah, well, the whole thing is getting to be suspect. But, with everybody suing everybody, this is the worst part. You get censored on the internet. You get censored on the news. And so there's this weird thing going on. I just want to call it out for what it is. Instead of the free and fair exchange of information, what we have is an all-time record low trust in government, and the government insisting you trust them with jabbing you with some kind of a vaccine. And I'm not even sure statistically that they're giving the accurate reports on the bad side effects that are happening. 39% of Americans question whether the vote that happened with the president was even legitimate. And that's based on The Economist magazine, and that's largely a Democrat magazine. 39%. How many people are going to trust the government when Fauci is talking about, well, this wasn't a gain of function, not technically a gain of function, but maybe a little bit of a gain of function, but that isn't what I authorized. Everything about this is a deterioration of confidence in government. And so I'm very glad we had somebody on tonight that even if he has to dodge, speak carefully, we got to get some information for the average viewer. because I myself am confused, and I'm a fairly educated individual.
All right, so Doc, take us through. Let's go back to the beginning. We kind of jumped ahead to the children, but in what we're dealing with, and I'll get you to speak to Delta variant specifically in a minute, but with the COVID virus, which we are not saying, and everybody watching, we're not saying it's not real. Okay, so don't post on your social media that's what I said. That's not what we're saying. But what I want to understand is this COVID virus, which now they're saying was engineered in a lab. It's almost common knowledge now in this. What should the steps be? Do you agree with Dr. Fauci, or should we be taking other steps? What should we be doing right now? If it was up to you, what would you say we had to do?
I've disagreed all the way through with the NIH and FDA, CDC staffers. I've testified in the U.S. Senate that our focus always should have been on early treatment. Since about 1% of the U.S. population developed COVID, we should have had all our focus on the 1% to treat them early. Remember, President Trump had COVID-19. He received state-of-the-art monoclonal antibodies and other oral drugs. He just breezed through COVID-19. All of our seniors should have received that level of care. It was available. It's still available today. Seniors get no offering for these monoclonal antibodies. There's no 1-800 number. There's no public service announcements. Patients still to this day go untreated for days or weeks outside the hospital before they crash into the hospital. Everyone should know that early treatment, drugs in combination to reduce viral replication, the inflammation, and the blood clotting work. I've published the 2 seminal papers that have proven that. It's supported by the Association of American Physicians and Surgeons and the Frontline Critical Care Consortium, American Frontline Doctors. All of these organizations should support early treatment. And if I was an agency staffer, I would have been really supercharging early treatment to keep these hospitalizations down. We know this approach reduces hospitalizations and deaths by 85%. It does way more than ever wearing a mask or a vaccine. Don't forget, masks and vaccines have to be applied to the 99% of people without COVID. So it makes no sense to have a vast waste of resources when we could actually just focus on the problem at hand.
All right, so you already touched on my next question, was that we've been talking about the only thing with COVID, the answer to COVID was the vaccine. So we've got the vaccine, but you mentioned it. We never heard about a treatment. We heard about hydroxychloroquine, all these other ivermectin. We've heard it, but the emphasis never seems to be on the treatment. What treatment should we be looking at, especially those of us that aren't 25 anymore?
I'd go to aapsonline.org and download the home treatment guide. It lays everything out on what drugs to ask for, how they're used in combination. Now, it takes a doctor to order them, and there are some national telemedicine services and regional telemedicine services that work 24/7. One of the most popular ones is called myfreedoctor.com, and it is free. It operates as a charitable organization, but we get these medications called in, and as you applied after the monoclonal antibodies, there's over 200 studies now supporting hydroxychloroquine, not alone, but in combination with other drugs. 60 studies supporting ivermectin. We combine doxycycline or azithromycin, common antibiotics. We have aspirin, 325 milligrams, all the way through. Inhaled budesonide, supported by 2 trials, STOIC trial and the principal trial, as well as wonderful observational data. We use oral steroids, dexamethasone, prednisone, and hydrocortisone. We use an oral gout drug called colchicine. And then lastly, most importantly, blood thinners. Many of your listeners have had a hip surgery or had atrial fibrillation, and blood thinners are not not strange to them. We can use injectable Lovenox as an example for about 10 days, sometimes out to 30 days in a senior. But when we put these drugs in a combination, 4 to 6 drugs, we can actually carry even a highest risk patient through COVID-19 at home, never go into the hospitalization. So we slow down the spread of the virus dramatically, reduce hospitalization and death. I've personally treated and advised on patients well into their 90s with great success.
All right, Lance, did you hear that? He's treated people in their 90s with great success. What do you think, Lance? Is it as simple as it sounds?
Well, the question that I've got is, and I hate to ask this because it's almost like stumbling into the obvious, is it that there is so much money in the pharmaceutical business of creating a drug that the workable solutions are squashed or get negative press or don't get government attention. What's the story behind this? I mean, break it down for the layman, because it sounds to me like the solutions are there, but that somebody's incentivized to come up with an alternative, and it looks like the pharmaceuticals are at the forefront of that.
Well, the pharmaceuticals,
Anybody?
you know, the pharmaceuticals that come to mind have actually been underused, including the Regeneron monoclonal antibodies. So, you know, the United States government pre-purchased 500 million doses of these, and they lay on the shelves with really no promotion, no advertising, and no access. So it's not really pharmaceuticals, but I think the real competing product is the vaccine. And we know that there is some overt conflict of interest of concern, including the fact that the National Institutes of Health co-owns the patent for Moderna. We've had several officials, Rick Bright and Stephen Hahn, who were, you know, working on the pandemic response as agency officials. They've actually gone to the vaccine companies and taken jobs. So it seems like the conflict of interest has really been the vaccine and the vaccine program. And it shouldn't be. Vaccination should be complementary to early treatment, but we need to treat that 1% over the course of the year that have gotten sick. We should never have left them without treatment. And we know vaccines don't treat sick patients anyway.